hope it's correct, 20 megabytes. So tonight we should speak about the peptides in the current situation, which basically I do not want to call pandemic, because nobody of us has ever seen the virus, and there are lots of theories, and none of them is of serious source. So basically what I would like to enhance is focus on the immune system in general, and once we have functioning immune system, we don't need anything else which would focus on the any antiviral or anti-infectious system of immunity. So what I am currently trying to explain is that peptides are the major regulators in our immune system. Peptides has been discovered in 1953 as the first peptide was oxytocin, and from current literature up to now there has been synthesized approximately about 200 different peptides which we can use for treating our immune system. So what is currently for us available are the oral peptides, which the leading company is Way, and Way is so still nobody, there are people writing me they cannot hear me. So tell me what we can do about the connection. And I can, yes. So you have to hear me, and it's not on my side, I hope, right? So we started using the peptides of boosting immune system. So the last seminar or webinar which we had was the one which was explaining the history, and currently I want to introduce you to the oral peptides which we can use for the vital role in regulation of immunity, and when we have regulation in full communication, then we have fully functional immune system. So whatever is coming from the hypothalamus and brain to immune system and vice versa is fully regulated immune system. Now whatever comes in the way of peptide immune supplements, they are from our natural sources. So if we're gonna eat properly, exercise properly, behave properly, we will synthesize our unique organic proteins and peptides along with essential minerals and vitamins from the food. The problem is that currently nor the food nor our regulation is having enough of the elementary nutrients and regulators that would guarantee appropriate and proper function of the immune system. That's why we are suggesting to boost the immune system, the weakened immune system, for in this difficult situation, which current world is being introduced through media. So we are having basically two major problems: primary immunodeficiency disorders, which we are born with, or which have some consequences from our birthright, and secondary, which are much more frequent, which are coming from malnutrition. I don't know if you would believe that 80% of people in Western Europe have lack of vitamin C. So if you would consider that vitamin C is the major regulator of immunity, as a major antioxidant, and 80% of the people have lack of vitamin C. So not speaking about any other sophisticated regulators like peptides. So the major part of this decreased regulation is caused by the stress. So here you can see appropriate regulation of hypothalamus pituitary adrenal axis. I don't know if you can see my mouse showing that the cortex, which is our consciousness, is sending signals through hippocampus and amygdala, through neurotransmitters to hypothalamus. And it basically takes 6 to 8 weeks to change your information in hypothalamus. All psychotherapeutic schools know it. And all psychotherapeutic procedures work with this issue. So currently, from this healthy hypothalamus pituitary adrenal axis, we are going to the impaired hypothalamus pituitary adrenal axis, which is this one. So you may see what the stress, and I'm not speaking about the stress just in this very moment, I'm speaking the stress in general. As you may see, that the levels of cortisol are being dysregulated through adrenal cortex, and adrenal cortex is dysregulating through cortisol immune system. So any stress, long-term stress, is based on impairment of adrenal cortisol, impair of the regulation. And the immunotransmitters to pituitary gland are excess, and the cortisol are in decrease. So you have excess on one side and decrease on the other side. Now, corticotropin releasing factor to the pituitary is excessive. Meanwhile, pituitary to hypothalamus is decreased. So from this point of view, any type of stress, which is now from the general point of view as a pandemic has been introduced, is causing this moment. This is what happens with most of the people who have the fear now. They have the fear of disease, they have the fear of death, they have the fear of losing job, they have the fear, all the fears are this. Please look carefully on this slide, because this is what's happening now in your regulation of immunity. Now, what can restore this? According to the old classical way, is the fight and flight. You know, so when you have this fight and flight situation, you can do it with the exercise. And exercise, always physical exercise, because that's the rudimentary mechanism which restores our immune function, is always fight and flight. we were programmed, if we cannot solve the problem, we run away. So to this solution, you should be like I put down here, 20 minutes of moderate exercise stimulates the immune system and produce anti-inflammatory cell response. So basically, we have the major response with exercise. The second most important is the dietary regime, right? Yes, and I forgot the chronic sleep deprivation, because sleeping, which activates the parasympathicus, is the most important part of our restoring strength of immune system regulation. And basically, when we have the enough sleep, what you feel enough sleep, somebody feels enough sleep 6 hours, somebody 7 hours, someone 8 hours. So all this is activating parasympathicus, but the parasympathicus is the healing mode. Most of us up to now, before the big event of pandemia, we're running on sympathicus. You have to do so many things, you have to do so many patients, you have to do so many meetings, so many presentations, so much business, and you never rest. So you sleep under sympathicus. So this is also very important for the restoration of immune system. Of course, dieting, there are basic vitamins. That's what I said in the beginning, that we have 80% of the population with vitamin C, and also vitamin E, A, and vitamin D, and also the minerals. Lots of people lack potassium. When you have lack of potassium, you have cramps, you have arrhythmia, and you have blurred vision. Then the blurred vision is then misplaced diagnostically as a multiple sclerosis. So you have to always look for the patient who is in current situation with the enough of the minerals. Now, the peptide bioregulators has been introduced to the market to cover all these issues, which you have lack, or the population has basic lack. That's what I said before. So peptides are the molecules of regulations, and they consist of the short peptides, which is 2 to 5 amino acids, low molecular weight, and they are always enriched by the minerals and vitamins to have one complex function in one formula. So when you have the 4+1 formula, that you have peptides, you have minerals, you have vitamins, you have enzymes, which have to trigger the work of vitamins, because not one single vitamin will work if there is no enzyme. So most of the enzymes which you have for the functions of proper metabolism, people are lacking. And essential fatty acids and polyunsaturated fatty acids. These are the basis for the cell membranes providing permeability. Because the peptides that we are in the oral form enter the cell through the membrane. So that's very important that you have the membrane peptides on the level of the full substitution of the lacking minerals. Now, the very important part is that we have a unique vegetable capsule. It's very important that you can bind the peptides in the capsule, and this capsule must be resistant to chloric acid of the stomach, because otherwise nothing is going to go to the body. So it has to pass through the gastrointestinal tract to duodenum, where it has been decomposed and absorbed to the body and induce the function. The advantage is that it's a very short peptides and low molecular weight, so they can penetrate easily to the cell, and especially that one capsule contains all the minerals, vitamins, and phytonutrients, extracts from the herbs. So this is a unique product in the aspect of combining everything. In the previous times, we had to combine the peptide, then we had to some mushrooms, some herbs, some minerals, some vitamins. So the patient had to take like 3-4 capsules in the morning, and 4 in the lunch, and 4 in the evening. Now you take, let's say, 2 a day, 2 to 2, and you have everything covered. Plus, it doesn't matter if you have any chemical therapy with the chemical molecules, which I still doubt some people can do it. And it helps on the acute medicine, and I highly recognize the chronic medicine in chemical way as an acute solution, but a long term cannot be done with a chemical medicine, because it always has a serious side effect, and we have all the literature that any chemical molecule will have a side effect. So I would be very considering thoroughly long-term usage of chemical medication. Now, the practical recommendation, you take, if your body weight is up to 50 kilos, you take 1 capsule. If it's 80 kilos, you take 3 capsules. It depends on what is the body weight. Now, the treatment course should be like 3 months. And of course, it's all individual on the clinical condition, so it's the variation is quite big. But when we have regular patients 25 to 40, you take it 3 months once a year. When you are over 30, you take it 3 months yes, 3 months no, 3 months yes, 3 months no. And when you have some serious dysfunction, you have to then deal long, 1 year long full, whatever. It's difficult to say on the condition, but on the preventative level, this is up to 40 once a year, over 40 twice a year. So now when we go to practical solution, currently what is the most important is the chronic infections, because the world is working on the chronic infections. So the key product is Protection Plus. So you always start with Protection Plus, and when you want to increase immunity, you have you put Thymocyte Plus, and you can put, because it's the intestine, and intestine is, as you all know, is basically the key to our immunity, and because the biggest endocrine organ in our body is the intestine. So your solution should be Protection, Thymos, Immunity, and Fla2, which is for the intestine. Now, when we look on the different, then you have Protection always, because it's a very good one for the I would say from my clinical from the clinical experience I have in 20 years in peptides, Protection Plus is kind of a blockbuster. because it works on any infection. There are some other combinations which you may use, but from the point of view of the medication of first choice, it's protection. And you can combine it with the thymus. We can combine it with immunity, and you can combine it with microflora, which is good for the intestine, and sometimes with the detox. Depends on the condition of the patient, which has for the current situation, if has been using lots of chemical medications, you start with detox and then you put a protection, then immunoflora. So the clinical aspect of every patient is extremely important. Now, second most important is parasitic infestation and intoxication. So there is another blockbuster, which is the Extract Cleanse Plus. And this works for all the parasites. I mean, you can't imagine from the vegetables, from the meat, from the fish, from sushi, from various types of non-cooked meat products. We all have parasites. You could not believe when you do the serious examination on parasites, how much parasites you have. I mean, Extract Cleanse Plus should have everyone in the world, in the Western world, as a prevention for any type of health disorders, at least for 2 months, just by itself, you know. Of course, when you combine it with the thymus, you increase the immunity, and depends what kind of parasite you have. So in this current situation, thymus would be always highly recommended. And then the detox. Because when the parasite dies, you must have something to get rid of it, you know. So there is nothing worse that you boost immunity and you do the anti-parasite medication, so you have allergy. Because all the toxins are flowing through the body, and the lymphatic system is not fully detoxifying. So you use the Detox Tide Plus, but in high doses, it's like 3 times a day, 3, because you really have to flush away. You have to have enough of the liquids, and you must have quite a bit of like a herbal teas or alkaline water, you know, which are showing you the possibility to get rid of the toxins. Now, what I mentioned with the hypothalamus pituitary adrenal axis, everyone is on this stress syndrome. Stress is basically what I have shown in the slide before, that we have all the sympathicus activation. So our adrenal suprarenal glands are in full power. To put them a little bit down, you must give them support from the Adrenal Tide Plus with microflora and nerves, because you are too excited and you have lots of symptoms of overexcitement of nervous system. So you put the nerves, microflora for your intestine, as always, and adrenal to calm down the suprarenal glands. Another option for the adrenal stress syndrome is immunity and epiphysis. If you look, I can go back now on the stress syndrome. I can go back to my 2 slides, which I'm showing you. So this, what we have to achieve using the peptides, you have to go from this back to this. Do you follow me, everyone? Can you see it well? Because this is where 80% of population is currently, because you are overwhelmed by the health system, by the political system, by the financial system, by the economical system, that nobody knows what it's going to be. There is a stress, because stress is coming from unknown. That's the fear. Psychologically, fear is unknown. And all the governments in the world are producing in the whole world unknown. There is going to be quarantine for 6 weeks or 8 weeks or 12 weeks or 18 weeks. And since there is unknown, this raises, right? And I doubt that lots of people would be able to meditate on an appropriate level to calm down, and because you can achieve your healthy state as this one by meditation. As Candice Pert says, meditation is the most organized function of the human brain. But once you have this impairment, which most of us has from the current situation, you have to use it with the adrenal stress syndrome medication. So that's what I'm showing you, is this combinations. And as you can see, there is an epiphysis cerebrate type plus, right? So this one, epiphysis, is the key for regulation of the stress, as well as melatonin. But melatonin is already a product of the epiphysis. So I should rather concentrate on prevention of producing melatonin and going back to the source. Now, autoimmune diseases, which are linked again to HPA axis. So whatever autoimmune diseases you have, it always comes from impairment of hypothalamus pituitary adrenal axis. So when you have the immune type plus, you have to combine it with the joints, for instance, for rheumatoid arthritis. Lots of people have a joint pain. So when you combine the immune with the joints, it's already important help. And of course, microflora, because you combine the joints as the cause of the pain with the immunity and microflora, because immunity, immune type plus, and microflora type plus is the communication between the brain and the body to calm down the joints. Now, another combination for autoimmune diseases, we have the immune as a first, and skin. For instance, when you have psoriasis. Psoriasis is also a very severe problem with the people in high stress. And we can recognize, lots of people having high stress manifestation of the psoriasis. But psoriasis is frequently from lots of toxins, so you must put over a detox. But when you have a strong detox, you must use and enforce the liver. Because if you do the liver, that has to metabolize all the toxins in the body and come to the conclusion that all the toxins will be finally disintegrated in the liver, and that's extreme overload on the liver. So you should not drink alcohol when you have immune, skin, detox, and liver. That's very important, that limited amounts of alcohol are advisable in the autoimmune diseases. Maximum to the classic level of 0.3 liter of red wine, which is a highly antioxidant for a man. Now, endocrine, the stress is always, which is currently in the world, stress is related to endocrine disorders. It's not disease, but we have lots of endocrine problems. So when you have always the protection microflora, because endocrine problem is linked to some kind of chronic hidden infection or inflammation. So you must be very careful about considering the inflammation as the key link to triggering the endocrine symptoms. But when you have the microflora, so you always look at the healthy gut. And gut-brain connection, which I was discussing from the last time, has been thoroughly explained. So the link between the microflora and the brain is always very important to sustain in a harmony. Now, there comes lots of women in the menopause and premenopause are linked to the thyroid problems. And thyroid, as I was explaining at the beginning with the HPA-axis disorder, is the key moment of the regulation of the endocrine system. So you may do this combination for the thyroid. Another option for the endocrine diseases is always the protection as the main one, and we have the parathyroid microflora, and this one. Yes. So the protection and the parathyroid, sometimes the parathyroid is more important than the thyroid. And you must have a very thorough examination of calcium metabolism, and especially in the elderly woman with osteoporosis, you have the protection with parathyroid. And now, pulmonary diseases. The question of pulmonary diseases is widely discussed because the media load us with the cases of lots of pulmonary symptoms like the dry cough, lack of nasal sensitivity, and so-called cytokine burst or cytokine storm. So again, there must be the solution for the bacterial or viral infection. So it's always the protection, and then you have the breath. It's a peptide for enhancing the function of the lungs. And at the end, we have the FLA2, which is for the intestine, because when the intestine cannot expel all the toxins, it goes back to the lungs. So you start to have a cough, dry cough, or heavy cough with expectoration. So in this aspect, you always have to ease through the intestine. The other option is the detox, because you have to release the toxins which the body cannot disintegrate. And for the moment that we have the liver. As I said before, the liver is key for any detoxification. So when you put the detox, you always have to put the liver, because the detox will never work without the function of the liver. Liver is the key organ of the body for any metabolic pathway, and the detoxification goes mainly through the liver. Also, kind of from the kidneys, but the most important part from this is the liver. So this is what I have to say for the moment for the peptides that we have been discussing, and of course any further questions you should put to for more protocols and case reports. you have to go to the current infomyreal.com address and eventually to order the products from the site. But I'm willing to help you in any questions that you have regarding the patients, because this is just the general view, which should not be binding and which should not be in any way guideline, because peptides are so different and so complicated in usage that we have to always combine many more. Okay, there's a very good question, which is multiple sclerosis. Multiple sclerosis needs Staphylococcus, hold on, I will finish the multiple sclerosis. So multiple sclerosis, you need to have 4 therapeutic approaches. One is immunotherapy, which is combined with the nerves. Lots of multiple sclerosis is caused by Borrelia. So you have the protection. Then you have rehabilitation, because you can't fix any multiple sclerosis without multiple sclerosis. Then you have nutrition. There's a very specific nutrition which should basically contain 60% of the fat and 30% of the proteins, and 10% of carbohydrates, mostly in green vegetables. Plus the protection, nerves, and adrenal, because every multiple sclerosis has a serious psychological problem, very serious. I have seen, let's say, 400 cases of multiple sclerosis in my life. Every single one of them had a serious emotional problem, very serious. So this is quite complex. The second question is introduce what to take about the Staphylococcus aureus. Staphylococcus aureus is 3. That's protection. That's the immune and detox. So, or the lungs, the pulmonary. Regarding epilepsy, you have 3. That's another question. What about the epilepsy? Epilepsy is questioned to 3, which is the intestine, adrenal, and nerves. Because adrenal, which are suprarenal glands, adrenaline is triggering to the nerves information which the nerves cannot sustain, so they conduct the impulse in a high level, excitation, and this excitation is bursting in the epileptic seizure. So you have to calm down as adrenal as well as the brain. Okay, so I'm showing the pulmonary disease, this one, so you can take the picture. So that's this one. So it's the one with the protection, detox, and liver, right? So take the picture, and there is another one with the protection, breath, and flato. So did you take both? Or should I take it one more time? All right. Streptococcus hemolyticus. So Streptococcus hemolyticus is protection, liver, and detox. Because Streptococcus is causing high level of toxins, and hemolyticus, it's the toxins that go through the liver. So you must kill the germ, you must reinforce the liver and enhance the detoxification. All right, guys, so there are no more questions. So I think that, yes, I use Flatu a lot because there is no, the Chinese medicine, when I was studying acupuncture, Chinese medicine says, unless your gut is healthy, you never die. So the Flatu and microflora are the key peptides to enhance. Of course, you can enhance it by other, like a proper nutrition, like your diet should be considered with the green salads, at least from minimum 4 vegetables. And the Flatu is used mainly when there is a dysfunction of the immunity of the furunculus or skin exacerbation of the endocrine disorder. That's Flatu. Microflora is when you are malnutrients. So when you have disorders of osteoporosis, when you have disorders of thyroid, you use microflora. So microflora is more for the endocrine and Flatu is more for the metabolic. Well, according to the book, which have analyzed red wine as the major antioxidant, there is a recommendation that combination of 2 glasses of red wine is highly recommendable because of the study that has been conducted as a French paradox. So the French who eat high-fat food with red wine have much less cardiovascular disease than Americans, which are low-fat, low-sugar. If above 80 kilos, should we get 3 capsules of each peptide a day? Yes, it's recommended. Depends what condition. If you take it as a preventative or you take it as a therapeutic. So preventative is 2. That's enough. But if you have a serious problem and you want to fix it, like you have somebody in malnutrition or osteoporosis, you must take 3 capsules because the legislation. Well, the cancer problem, it's a very good question, but it would be for a special seminar, which we hopefully will select soon, because in cancer you have immunity, you have metabolism, and you have psychology. So I think I will conduct one special webinar for this event for the cancer especially, because I think it's becoming very important, and peptides are the key for the solution. I mean, for your information, in the pipeline of 260 peptides which are being studied in current pharma market, 80% is related to cancer. So I think it's worth of a special seminar. Each therapy is for 3 months, twice a year. Yes, if it's therapy, you should have it 3 months, then 2 months off and 3 months again, and 2 months off and 3 months again. leukemia. What kind of leukemia? We have great successes with non-Hodgkin lymphoma, with chronic lymphocytic leukemia. It's a very general question, but in general, peptides respond very well to chronic leukemia. It's responding very, very well. So you should have the, but depends on the cause. But basically, you have the combination should be protection if there is any cause of bacterial infection or viral infection, then adrenal, because every leukemia is linked to hypothalamus pituitary adrenal axis. It's always. And then microflora, which is for 3 months. The next 3 months should be thymus, immune, and FLA2. Depends on the clinical, and of course, high doses of vitamin C. High doses. And for the bone marrow, spirulina. So you have to always combine some other, because you have to think that peptides are like the bricklayers, but the bricks are the material that you bring to the building. So sometimes it's spirulina, sometimes it's arginine, sometimes it's maitake mushroom, shiitake, whatever. So that must be. If you write me, I can give you for the clinical protocol. I can give you clear recommendation, because all the recommendations which we are setting up here are very general, and it's more for the protection side. Okay.